with our event. Again, I would like to introduce myself. My name is Donalda Ammons, and I will be your MC this evening. I'm here to facilitate our discussion and also the panel discussion with Love. This is the With Love webinar. I'm pleased to thank the Center for Deaf Health Equity at Gallaudet University, which is led by Dr. Poorna Ksholnagar. I also would like to express our deepest gratitudes to the Gallaudet Alumni Relations Office for coordinating this event and inviting many of the alumni to register and participate in this webinar and to watch the premiere of this documentary. The documentary was produced before the pandemic. And I would also like to mention that we have 4 panelists who will engage in a discussion after the viewing of the film. We'll be able to ask questions and also have some guided questions for the panelists to engage in a discussion. And also we welcome audience participation during the question and answer period. For those of you who have joined and watched the film with us, again, we invite you to submit your questions via chat, and we will select the questions for the panelists to answer. Or if you would like to ask a question to a specific panelist, you can include that panelist's name in your chat. Or if it's a general question for any of the panelists, you can simply just submit your question. Once the Q&A is finished, I will allow Dr. Ksholnagar and another individual from the film to offer some closing remarks for the program. It seems that we are ready to go ahead and begin our event today. I now would like to introduce President Bobby Cordano for her video welcome remarks. And also I would like to add that you can send your questions using the Q&A button that you see in the ribbon on the bottom of your screen. If you hover towards the bottom of your screen, don't use the chat, use the icon that says Q&A to submit your questions for panelists. And now I'd like to introduce President Cordano.
Thank you all for joining us tonight. I am so thrilled that Alumni Relations is hosting this special webinar. This will be the first time we are showing this unique documentary that we have created. This documentary may be brief, however, it will have a deep and lasting impact. The producer of this film was Dr. Poorna Ksholnagar. Her name sign is as follows. She is the founder of the Deaf Health Equity Center here at Gallaudet University, which is abbreviated CDHE. The funding for this was granted to us by NIH, which means the National Institute of Health. We are incredibly grateful for their generous support. Dr. Ksholnagar has founded the Center for Deaf Health Equity, originally in 2015 at RIT. It was then moved to Gallaudet University in 2016. She has since then been the director of CDHE, and we are very proud to host the center here at the university. The work of this center is focused on studying deaf and hard of hearing people who use ASL and their connections to their health issues. The research we are collecting will set up a good foundation to support better quality of life for all deaf and hard of hearing signers. Prior to my time being here at Gallaudet as president, I was involved with an organization in Minnesota called Act on Alzheimer's. My work there had a profound impact on me, and I realized how severely our country is facing a crisis of a lack of resources for caregivers. Those resources are even more scant for those who use ASL, and they're incredibly lacking support, and this is a nationwide crisis. The Deaf Seniors of America, DSA, and as well as deaf community members made this film possible, and I want to say a big thank you to all of you. People who are deaf and use ASL must have trained caregivers who can communicate with them in sign language so that they can have essential connection and understanding. It's important for the community to engage in discussion on this issue. So my hope is that this film and our panel discussion will spark much more discussion in the future and start a movement. Deaf caregivers care for their partners, their family, and they want them, those who have dementia, to take care of them. However, it is very difficult and they face many challenges. And we see them and we understand that. So this film and the discussion, I hope that this will help our audience better understand what those challenges are and what we can do moving forward. So thank you again for joining us.
Hello, everyone, and good evening. As President Cordano said, she beautifully said that this is an important discussion for our topic. My father, or our topic for discussion within our community. My father has dementia. And again, to introduce myself, my name is Dr. Purna Kushal-Nagar. I'm the director for the Center of Deaf Health Equity. The film also is produced within the community, and it involves different deaf adults with their personal experiences. Myself was there in part of the production, and Stacy as well. We met in 2010 and have had many conversations and discussions around health and how different impacts of the community, how different parts of the community are impacted. And we wanted to figure out a powerful way to impact some sort of change to the system and to people's lives. In 2017 or 2018, I can't remember the exact year, there was a conference where we discussed health equity for deaf people in the deaf community, and it was a very profound discussion that we engaged in throughout that week. We found that there's no resources for folks with dementia and how we can best provide care for their parents, and listening to people's stories and their experiences with their parents who have dementia. I figured, what can we do? And I myself, as a researcher, developed a proposal for the funding for this. We couldn't get people, I couldn't find folks to be involved, but I could get money and funding for something like that, which is where the money from the National Institutes of Health came into play, to talk about the quality of life that people receive, their caregivers, and folks with dementia and Alzheimer's. So we received the grant, and at the same time, I was on the NAD task force that was led by Dr. Ammons, who was very passionate about providing resources to caregivers and to people who experience dementia. And through their work and talking with President Cordano, pushed and felt that Gallaudet needed to be a resource to be able to support the community. That matched my interest. And I was able to collect data, both through a qualitative survey and quantitative interview data through interviews. And we're able to get and recruit several different caregivers to participate about the work that they did, about the time that was required, and how many hours. And we engaged in several hours of discussion prior to them sitting down for an interview, and really enjoyed their discussions, their empathy that they experience during their caregiving experiences. And I think that it's important to recognize Juan F., who is in Puerto Rico and was able to help connecting us with different caregivers in Puerto Rico who use Puerto Rican Sign Language to be able to connect them to engage in a discussion to engage in discussions virtually if as needed, so that the deaf people in Puerto Rico could participate in this study. There was a great research team. Julia Velasquez in Sweden did a really great job of coordinating and managing us and our time and making sure that we met deadlines, was very patient and very professional. So my deepest gratitude to her. We wanted to make sure that we were telling a story and not only just collecting data, but wanted to share their personal experience with this. And that's where Stacy comes into play. And I thought it was a perfect person to help with the film that would touch deeply on people's emotions and understand the sensitivity surrounding this topic. With no reservations, I contacted Stacy. She was talented with this endeavor, and I'd like to turn it over to Stacy for some remarks.
Thank you so much for your kind words. I really appreciate them. As you can see, we are very different. Dr. Kushnavar is an expert researcher, while I, on the other hand, am more of an artist type. And however, we share the same heart for many different topics. So when she reached out to me, I was thrilled and honored to be a part of this work with her and with her amazing team. Dr. Kushnavar has done incredible work, as well as the other people on her team. You are very compassionate people, both of you, and I really appreciate that. So I am honored to be a part of this and to be here. This is an incredible opportunity to create this incredibly important project. As a caregiver myself, I take care of my father, and I have for the past 5 years. And I now have quite a passion for this issue, this project. And I've shared this within my close friend group. And the story that is being shared in this video with Eileen is beautiful, and what she has to say, and the love of ASL also, and why this needs to be told in ASL. It really captures the true essence of this mother, and just the jokes and the stories. And I know that within my friends, people group saying it's not right to make fun of your parents. However, in this moment, and for me as an Italian, as Frank is as well, we understood each other. That is part of Italian culture. Within families, we tend to some degree, mock or lightly make fun of each other with love. So without further ado, I'd like to present With Love.
Yes, enjoy the film, everybody.
Of dementia. It wasn't like 2 or 3 years or anything. It really happened all in July.
I must practice letting it go. I was starting to feel overwhelmed. Wow, the brain actually shrinks? Mom was worried that I would put her into a nursing home. I assured her, no, Mom, I'm going to take care of you. Just like Mom took care of us, it's our turn now.
Right.
I want to continue taking care of you. She said, you don't have to come and visit me. Why? I can take care of myself. I had to tell her, no, Mom, you can't. But she doesn't listen to me. I've just decided to let her think what she will.
We have to find the humor in these stories.
I have to take care of myself or I'll lose my mind.
Yeah, what makes it easier is that we all love Mom.
Father had a stroke. It was probably 13 years ago, right?
Yeah, it was in 2007.
Yeah, so 13 years. Yeah, I'd been going back and forth to Philadelphia to take care of everything. And when my dad passed, I had to take care of my mom. More and more the disease had started to take over, but I hadn't recognized it at first. When my dad had the stroke, Mom asked for help writing checks. Seriously, I thought you knew how to write a check. No, your father was in charge of everything. Ooh. So I saw what we were up against and was willing to help. And my sister Rosemary hadn't been aware of the situation either. She's good at math too. And we decided I would take over Mom's affairs. That's when I really took notice of how much she was changing. That was last year. I think it was around Thanksgiving. But really over the course of the last 3 years, she had already become forgetful. Sometimes, she would accuse me of stealing some of the things she kept upstairs. I was always dumbfounded, and every time she'd go upstairs in a huff, that always spelled trouble. She would come downstairs later, a completely different person. I'd say, Mom, what are you talking about? She'd say, I know you stole something from me. Come on, give me what you took right now. What? She'd respond, you're a thief. You're a thief. You took things from upstairs. I'd ask, okay, Mom, what did I take? What? She would say it took a bunch of different things like makeup, money, toothpaste, bracelets, watches, and tomorrow it'd be a different list of things I'd stolen. She'd go upstairs and then come back behaving like a different person. 2 hours later, she'd go upstairs and change again. And that's when I realized that's not my mom. When all this started, I would share all of this with my wife. She would listen patiently as I told her the stories.
Right. I started to see it for myself by observing her behavior, and everything matched up, and everything was Alzheimer's. And I thought, oh, so I discussed some of this with my friends who are taking care of their parents too. And as I asked them questions, it all kind of matched. It was the same. So we kept encouraging Mom to go for some testing at the doctors.
She refused.
Yeah.
And I would explain everything to the doctor, but we had to communicate by writing notes back and forth.
Right. In Philadelphia, the interpreting access is Rochester here, we've got wonderful interpreters, but Philadelphia doesn't have the same. Now, your mother's doctor's office is a very small office. They're not familiar with ADA laws, and so we're really trying to work out that problem.
Our family had gone to the same doctor's office for almost 60 years. It was close to where we lived. You know how it is right in the city of Philadelphia. Everything is within walking distance. The doctor's office was just a simple walk, maybe 4 or 5 blocks from home. And since she'd been going there for 60 years, Mom would say, oh, I can lip read the doctor. Oh my goodness, Mom would always say, I can lip read. Don't worry. We had this conversation over and over again.
I'm used to lip reading. I did not sign much. Now I sign fairly well, but I lip read more. Ask him.
I wrangled with the doctor's office, and they kept saying they couldn't afford to hire an interpreter for us. So they suggested that we consider switching doctors. But my mom was adamant that she wanted to stay. I called the doctor through an interpreted video relay. I explained that Mom was forgetful and she seemed to have dementia. And that's when the doctor started to pay attention. And I said I should bring her in. I explained that for communication to take place, we would need an interpreter and that writing notes wouldn't cut it. The doctor insisted that there had to be an in-person visit in order to make a referral. So I ended up calling my daughter to help us figure things out. I mean, my daughter was willing to do so, but the appointment kept getting postponed because of logistics and coordinating everything with her.
Yes, and then in July, something serious happened. A friend of mine called and said, hey, I can't get a hold of your mother. I've been trying and trying. And I thought, So I tried texting and doing the same thing. Frank text, my daughter text, Rosemary had been trying to reach her. So everyone was trying, and we were really concerned.
It was 100 degrees upstairs, and she had just been lying there this whole time. Meanwhile, everybody was trying to contact her, and she wasn't answering the phone nor the door. The neighbors were all looking for her. We were all worried. The doors were locked, so the next door neighbor brought over a crowbar and broke the lock on the door. We was finally able to get
Mom was
inside.
upstairs laying on the floor with no air conditioning, just nothing, and Mom was just covered in sweat, and she was immediately taken to the hospital. And then we explained to the ER doctor that she has fallen 4 times already. And we filled them in on all these other things that were going on. And so they went ahead and decided and said, let's do a CAT scan. And after that, they diagnosed her with pneumonia, dehydration, and at the same time, they confirmed she had dementia. And we asked, how could you tell it's dementia? And they said they can see the scan of the brain was shrinking. And I thought, oh, I learned something. And that's how we found out, right?
The brain is getting smaller and smaller. After that discussion with the doctors, right then and there, I became completely overwhelmed. And then numb. My daughter was taking care of everything, managing the interpreting and connecting us with the right people. I was feeling useless because it all started to sink in. The brain actually shrinks? Interesting. That would explain her recent behavior. And still she was saying, why am I here? Why am I here? I'm just fine. I'm fine.
We tried to explain to her really carefully, you didn't drink enough water, you're sick, you have pneumonia, and she, taken aback.
She's a very hot, strong, and high energy
Yeah,
woman.
definitely a strong woman indeed. Very strong woman, she really is. But at the same time, the doctors were just straightforward with her and said, you have dementia. Yeah,
And
she didn't get
understand. She asked us what it meant. I said, well, you forget things a lot. And she said, I am not forgetful. I am not. Ooh, this is going to be tough. The doctor came in with a social worker. I think it was a social worker. They tried to force us into putting her into a nursing home. And I said, absolutely not, and started arguing with them. And our daughter also got involved. I insisted that she come and live with us. I had to prove I had power of attorney and some other stuff. Unnecessary. Mom could totally join us. I did not have any energy.
Yeah, fortunately, after your dad died,
what a headache.
We went and saw a lawyer, and he suggested that we get a power of attorney to prepare for Mom in the future. Assign any papers, so not even a power of attorney, because in the eyes of the law, they're deemed incapable. And so they're not even able to. So lucky thing, fortunately, that Frank, he already taken care of this in advance, and he signed everything. He had the health proxy signed, and just the formal test results came back and confirmed she had dementia. So Frank had all the legal documents prepared for his protection.
What a headache. It was a headache, but you know what? Thank God for my wife, because she did all this for me. I was clueless. I am not adept with English.
Right. Well,
I was overwhelmed.
you're good at math. I'm good at English. You're a finance guy, and I am a researcher, so there you go.
Perfect.
It's a teamwork.
Hiding
Yeah.
everywhere.
That's Mom. That's Mom. For
Mom.
example, one of the signs of dementia is that you hide things and you blame other people for things you can't find. And I quickly would have to look high and low for them and give them to Frank. Fortunately, the lawyer had the original copies anyway, so made copies and gave them to Frank. And once we had everything, we gave him to the hospital. Mom could finally be discharged.
Not back at home? At the house? They said, nope, go directly to Rochester, bring everything with you. I was reluctant, but I agreed. I ended up getting a U-Haul and carefully chose what I thought would be most familiar to her, which were her bedroom items. That's all. Rosemary's son, my nephew, and my son and his husband, and also my daughter Carrie, all worked together packing up all of her things. Once everything was packed up, I drove the U-Haul and we caravanned over to pick up my mom. And we headed directly to Rochester. Two days later, my mom thanked Kari for bringing her here. She expressed her gratitude to Kari again and again. I said, hey, I was part of this too. And Mom said, no, you didn't. It was just the two of us. I said, Mom, how do you think you got your bedroom stuff from Philadelphia to Rochester? I took everything with me into U-Haul. She accused me of lying to her. I countered with, but Mom, how did you move everything? She said, well, we put everything in my car.
Oh, Frank is wonderful, a good person. He helped me a lot when I was sick in Philadelphia. He drove back and forth to help me. He drove back and forth to take care of the house, too. Back and forth.
No, you didn't, Mom. How could you fit everything in your car? It's way too small. And I realized I had to take Eileen's advice and learn to just let it go. I had to learn that lesson because arguing with such a stubborn lady gets you nowhere. Mom got it into her head that all of those times I was commuting between Rochester and Philadelphia, I was looking for money. Mom said, Rosemary is plenty smart. And she doesn't want my money. I told her, now be reasonable. She said, I know you were trying to get my money. And now that you've got me here, you're going to rob me. I said, how? How? I pay all your bills. I take care of you. I do absolutely everything for you. But she will argue forever and never budge. Again, I had to practice letting go. Over and over again, just to keep my sanity. Sometimes Mom makes rounds in the house and comes out of the bedroom and says, where's your father's ring? Again, I am always so shocked and remind her that the ring went with his body. She would say, you took it off from him and you kept it. We go back and forth about that. Me insisting that he was wearing the ring when he was cremated. Her saying she knew that wasn't true. Once again, I just have to say to myself, let it go, let it go. Man, it's tough. In the morning, I get up and prepare Mom's medication. Eye drops for her dry eyes, which give her a lot of trouble. 6 different medications and vitamins in a cup. And on top, 1 for her throat. So when she comes into the room, first thing I do is hand it to her. She complains about having to take 3 vitamins, and I remind her it's the same every single day and has been forever, but she insists no, that she's only supposed to take 1. Next day she'll say there's not enough vitamins. And back home in Philadelphia, she would take 6 vitamins.
Right, but that number always changes.
6,
6,
5,
7, 5.
She's obsessed with her vitamins.
Mm-hmm.
We brought her hope chest when she moved here. It's been in her family forever. My grandparents had it and gave it to my mom. And inside, there's a set of antique silverware. Silver. Mom got so upset when she saw them. Where are the gold ones? I had to remind her that there never were any gold ones. She brought it up again and again. That particular obsession persisted for months. Again, patience is the name of the game. Not long ago, my mom said, "You sure are a clever one. You dyed the gold silverware to look silver." What? That's the new spin on things. I said, "This is all in your imagination, Mom. I didn't do that." She said, "You can't pull a fast one on me. I'm not stupid." She just could not get it out of her head. I give up. She can think what she will.
Yeah, again, we have to find the humor in these stories. We have to.
So intolerant and against things she wouldn't have cared about before. She'd forgotten her previous attitudes. My daughter is lesbian and married. My son is gay and married. Mom started to make discriminatory comments, and I had to remind her that her beloved grandchildren are gay.
I'm not against gay marriage. It's their business, not my business. They're happy with what they want. I refuse to criticize them. Their own business. I refuse. Why the need to criticize them? That's what they want. Right. Today, everybody is gay. Leave them alone. Leave them alone. Leave them to God.
She forgets her previous attitude of acceptance. She's not the same as before.
I mean, you have to let go to live in her world, so to speak. Because
it's not my mother.
Yeah.
Stroke that I would not put her in a nursing home. Shortly after my father's stroke, my mother said, "When he passes away, you're going to put me in a nursing home?" And I said, "No, I would take care of you. Don't worry, you're thinking too much about the future. Calm down. That's a long time from now. Just relax."
Remember when your father did have a stroke, he was put in a nursing home.
Yeah, we saw what that was like.
I mean, that nursing home was a bad experience. And then when you brought him home, you both took care of him for 2 years.
They had my father basically parked in the corner of a room, staring
in
at
the
a blank
nursing
wall,
home.
oblivious
That's
to
what was
any
going on
activity
over
going
there.
on behind him in the unit. I lost my mind. I was enraged at their treatment towards my father. I mean, what is wrong with you people? You wheel him into a corner, hands placed in his lap, and just leave him there? It looked like he was being punished for something.
So, yeah, and he was the only deaf person there.
Out of there and said, "I promised him when we got married I'd always take care of him. He's coming back home." She did a good job too, even though she's only 5'2". My father was a tall guy. I don't care. He's coming back home, period. I knew there was no way of convincing her otherwise, so I honored her wishes.
Deaf citizens, deaf citizens, deaf citizens there. Deaf, I like it there. Here, I don't know.
She took care of us way back when.
That's
And
right.
now it's our turn to do the same for her. She's always been so good to us, so caring and giving. And now we give back to her.
It's really important that we just love Mom. And that's what helps when things are rough. We love Mom.
Yes, love, love, love you. Love each other.
Hello again. I hope you all enjoyed the film. It's very powerful. I would now like to invite Eileen and Frank to join me on screen.
Hello.
Hello, Eileen and Frank. How are you?
Hi. We're
I'm
good. We're so grateful to be here.
Great. I'm thrilled you were able to join us tonight, and I'm sure it was nice to be able to have all of these people watching the film. I was wondering if we could ask about an update. It's been about 1.5 years since the film was created in 2020, and it's now September 2021. Things changed or anything that you'd like to share with us?
Well, there's been a lot of change.
Yeah.
With the time of COVID, of course, things have gotten much worse. My mother has had to stay in the house. So I've seen her struggle. She doesn't understand why she can't go outside. And she doesn't understand masking. And so I have struggled trying to teach her what's happening at this point. But she can't seem to get a grasp on all of this new information, this new environment that she's not used to.
Yeah, so I've started to work from home. I work at RSD, Rochester School for the Deaf. So I've been working from home. And so because New York has required all schools to close, and students and teachers had been staying home and working and learning from there. So I've seen Mom kind of decline. It's not been rapid, it's been a steady decline. So the majority of 2020, we had about a big situation in October where we had to take her to the hospital because of medication and change some medications. And
Wow.
so she had come after me with a knife. My husband saw and was able to restrain her. And so we had to change up her medication some to find the right combination of medication to help calm her down. And that's been working so far, but she's just not been herself. She's been declining a little bit. So for example, our daughter is here in Rochester visiting from Colorado. And, Mom saw her and didn't recognize her at first. Her hair had changed, our daughter's hair had changed. And so we were sitting, and Mom was sitting next to her, and my husband and I were sitting next to each other, and my daughter across from us, and was asking about how's Mom, and it was like, oh, well, I'm right here.
Wow.
And that really struck a chord.
Right. That repeating questions over and over. Hey, where's your mom? and just marching through these same things and having to just restrain my feelings and seeing my daughter see this in her and starting to understand what's happening. And when she said goodbye, she's like, okay, do you understand when I'm leaving? And she said, okay, goodbye, I love you. And then when she left, that was just hard.
Oh, I'm sure that broke her heart, broke your daughter's heart as well, and you as well,
Mhm.
Eileen. I mean, you were sitting there and saw, it was like if you were not there in the room.
Right, right.
Oh, I'm sure that's challenging. I know that a lot of people don't uh, kind of realize, you know, what you two have experienced and gone through. I am a caregiver for my mother, and other deaf folks as well. And uh, I know that, what you're experiencing is real. And I think that them watching this video allows them, it gives them a connection and understands that they're not alone in several different ways. And the mother still lives with you.
Yes, she is still here with us, right behind us, actually.
Yeah, she's just in the bed. She's in the other room watching TV.
Yes, and one example is I have a family friend who's their father has dementia. And so we kind of saw that and saw them go through that, but we didn't understand until we actually experienced it for ourselves. And that was really eye-opening. And how I behaved towards that family, I now regret now that I understand. And I was just sending them, oh, I hope for the best. I hope she gets better. He gets better, but that's not how this happens. People don't get better from this. And so um, that caregiver has perspective is really unique on how to handle dementia. It's a unique experience.
Yeah, and we've been searching and made several calls because I wasn't comfortable with bathing, and I love mom, but I just wasn't comfortable with that. So I was, trying to find something, and it's just been a challenge to find something. It took almost 2 years of really searching, and we finally found somebody last Monday. Finally,
Wow.
that was great that we were able to find somebody to kind of give them a chance to kind of see how things go. And so they came yesterday again for the second time. And so they'll come again. We want to make sure that we give them a chance to kind of see how things go.
Wow. So I just want to thank the two of you for your willingness to take on this role and be in this film. I know that you opened yourself up, you exposed yourself to be vulnerable and share all this. But I want you to know that you are incredible people and you have helped us and so many people, deaf people, hearing people as well. This film will be shared far and wide and it will have a tremendous impact. So thank you. I'd now like to invite our other panelists. All right, so I'm going to go ahead and welcome Sandra Bradley.
No.
And Eileen and Frank, go ahead and stay on, but I want to say hello to Sandra and Jose. So hi, Sandra Bradley. Hello. Jose, Ovi, Velasquez. All right, so I have a couple of questions for you two, Sandra and Jose. And I'll allow you to kind of introduce yourselves. Who are you? What's your background so people have an idea of who you are? Let's start with Sandra.
Yes, hello everyone. My name is Sandra. I'm here in Rochester, New York. My mother is hearing and has dementia. And I brought my mother, I brought my mother from Germany to live here. She's been here for 6 months with my family. And then 6 months after that, we moved to a different location.
Memory care.
To memory care.
Thank you. And then Jose, would you like to introduce yourself?
Yeah, I'm Jose. I'm in Texas. My mother is hearing and has dementia. It's in the early stages, but has lived at home with me for 7 months, 24/7. Over the last 7 months, things have been kind of quiet. I've had to leave home to go to work for the last few weeks. And my sister said that's probably not the best idea. We have to figure something out. So we left, and that's the situation we're in now.
Oh, my apologies. And Sandra, is your mother still living?
Yes. She's 81. She had a stroke at 65. And the doctor at that time was aware that there could be a kind of decline in the next 10 years. And then at the age of 75, my siblings and I recognized that she was forgetting a lot and that dementia probably was starting to that's really when we noticed the signs of dementia. And then after that, we waited and finally brought her here. So she's at memory care now. And the dementia has gotten a little bit worse. She recognizes me, but when I visit, she's not always sure. My mother is hearing, so I use my voice. She signs a little bit, but she recognizes my voice. So yeah, it's tough. So seeing that film is really impactful.
All right, so I have a question. And I am so sorry to hear, Jose, that your mother passed away. You said a couple years ago?
Yeah, 2017.
Wow. My heartfelt apologies. I know that we really cherish our family members, and losing a family member is always difficult. I lost my mother as well in 2020, and it was incredibly difficult. So I have a question for the two of you, Sandra and Jose. What are your reflections upon seeing this film? Seeing Frank and Eileen sharing their experiences. Sandra, what are your thoughts?
So my initial reflections, really, particularly when it comes to communication and technology and training of caregivers, having a care plan, thinking about in-home services. I really feel for the two of them and what everybody's been through. Your mother's still living at your home. My mother's not living here. And I know that it's overwhelming and it can be a struggle. I've felt that before. So I empathize. It's hard to control more. And as things became a little bit, the situation deteriorated, I thought that memory care was a good place for her to be. And so far it's been great. Thinking about the definition of dementia, we didn't know, like what Frank mentioned, what's wrong, what's going on. And, she put a lot of blame on me and would guilt trip me often, would call me a liar, would call me a thief, and so many other things. And yeah, it's a lot.
Thank you so much, Sandra, for sharing your reflections. Now I'm going to turn it over to Jose. What are your thoughts upon seeing this film?
So I've had lots of friends, who don't really understand the frustrations. They have families, that have dementia, but they would never say anything. And so it was hard for me to find support. And so seeing this film, we really want to get this out there because we want people to be open about these conversations. And kind of seeing that story, I connected and related to so many of the experiences that Eileen and Frank mentioned. Just saying, okay, and accepting the things, not just, nodding at folks and saying, oh, yeah, but actually saying, okay, to whatever they were saying. That goes on. 7 days a week, about 3 hours a day, the nurse would come in and the nurse started recognizing that SSI and Medicare had covered everything for 3 hours every day to take care of things like bathing and laundry and meal times. So their comments really resonated and are powerful, and I'm really thrilled about this film. So thank you both for that, and thank you.
I agree. Thank you so much, Frank and Eileen. And a thank you also to Stacy and to Porna and all the people who made this film happen. For all of us who are in the situation to be able to feel like we're in this together. So I have an open question for all of you, Frank, Eileen, Sandra, or Jose. This can be for any of you. Do you feel that you are the only deaf people providing care, or do you think that there's a lot of people out there in the world, right? People who are struggling to find care for their family members, people with dementia, and they need support. So I am wondering, if you think about those people out there who need support, how can we reach those people? How can we get in touch and create a network? I'll start with you, Eileen and Frank.
So when we received the diagnosis that it was indeed dementia, I was very lucky to work at the Rochester School for the Deaf. I had known folks that had parents who had dementia, so I was able to connect with them and to build that network of people who had similar experiences. I joined a Facebook support group. It was mostly hearing people, not many deaf people. I did meet some deaf caregivers.
In that group?
Yes, through the group, through that forum on Facebook, I was able to connect with some folks. My goal is really to start a support group for caregivers of adults who have dementia or different health issues, regardless
Or
of
general.
their health issues. Yeah. I mean, there's a high percentage of dementia, and we want to make sure that we start a support group for those folks.
Mm-hmm.
So that they're able to connect and network with other deaf people of similar experience. Many deaf people might not be on Facebook, and that's a big issue, so they don't have access to that. So
you're right. Facebook is somewhat limited in its reach. But regardless, that's a great place to start. Perhaps a baby step. And then from there, Sandra and Jose, do you have any thoughts?
Well, this is Frank, just to add really quick, so many things are changing, and we've adapted well, so it's been good.
Definitely.
The concern is, with other people, we want to make sure that we're able to express and educate them to kind of wake people up some, because, as people get older, everybody's getting older, and we have to make sure that people are taken care of down the line as well.
Absolutely. Thank you. I really appreciate what you're saying. We owe a lot to people like you who are willing to share what you're going through, and you will have a wide and far impact. Sandra, Jose, I want to we'll let Jose speak first, and then Sandra after that. So go ahead, Jose.
Is that good, Sandra?
Sure.
There was limited resources. I didn't know much about my mom and for interpreting services and what things need to have, that are necessary. And I recognized, there was lots of resources that my friends had, and I thought some of these online resources might not have been the best for me. I was confused. There are different websites and Facebook. There weren't many people that were there looking through that I had access to. And so I wished that I had had more access to that. It was really challenging.
Do you feel like now you have better resources?
Yes, absolutely.
Great. Sandra?
Yeah, before I really didn't know. I thought, okay, I could get involved with some research, do some interviews, talk with people, to find some caregivers for their parents. And that was really beneficial to be able to come together with folks or to learn, that there are people all over that are out there to help you, to connect with for support. Facebook was a good start for those types of things, and it's nice to have hearing people involved with that, but it's also nice to have direct connection with other deaf people who can provide workshops, who can provide training. So it would be nice if Gallaudet would be able to, it's great that Gallaudet has founded the Center for Deaf Health Equity, so that people can use that resource to get the support that they need. And I'm happy, to support those who might need it or to be there for other folks.
Thank you so much, Sandra and Jose. Really, all four of you have had wonderful input. Actually not one. There's actually several people who've mentioned they wish there was a hotline,
Oh, yes.
like a 24/7 hotline, because it's hard to predict. You don't know what's going to happen in the next moment or in the next hour or perhaps tomorrow. You just don't know what's going to happen. So having a hotline in ASL that people can access, because hearing people do have that, and deaf people don't have access to that. While hearing people have someone that they can call in an emergency, we don't. Sandra, you wanted to say more?
Yeah, I'd like to add, when, my mom had went outside without, I had to call 911. And she was like, "Oh, I'm fine. I just went for a walk." And I thought, "Oh, no. I mean, she left. It was, that was a little bit of a breakdown. And I wish that we would have been able to call this hotline to have an interpreter available. It was really a bad experience.
Wow, I can imagine. Yeah. Um, I think all of us are hoping that as we're making progress, more people will, in essence, come out and share. I think that sometimes people are embarrassed. There's a lot of stigma around this issue. There's a lot of shame people experience. They think it might be their fault or feel guilty.
Yeah. Guilt is number one. Yeah.
Absolutely. People are grieving as well as they see their husband or their wife change so much and wonder if they caused it or did something wrong, or if there was something in the environment that caused this problem. A lot of people don't really know and they keep quiet about this. But I think that more of us are speaking out, and that will help other deaf people who are caretakers of those with dementia come out and come out of the woodworks and share. Additionally, I think with this film, as it's going to make headway, I think throughout the deaf community, there's going to be a change. There's going to be more understanding and more connection, rather than it being a bit of a gossip piece, like, "Oh, I found out they have dementia," and there's the stigma associated with it, and caretakers might feel shame because people don't know how to treat, say, their husband or their wife or their other loved one with dementia, and the way they repeat themselves and some of those other issues that we are all facing and we're talking about. So that's wonderful. Okay, I'm going to go ahead and move on to our third and final question, and then we'll be on to the Q&A from the audience. So the last question on my end, we've been discussing deaf people and using Facebook or website or a hotline, but regarding the medical profession, doctors, nurses, social workers, they're often hearing people who just don't get it. They don't understand deaf people's needs or ASL and why that's important. Not only the person with dementia and their access needs, but also deaf caregivers. If, say, you have a hearing mother with dementia, however, you are the person who is deaf, who is taking care of them, and you need communication access as well. That's the same for you, Frank and Eileen. You talked about that in your film, struggling to have access. And you were so grateful for your daughter being able to fill that role as the interpreter and facilitate communication. And your daughter was able to advocate for you. And there are some deaf people who don't have that sort of resource and that ability. So I think the big question is, and I see, Sandra, that you want to respond. Let me finish the question.
Yeah.
How can we educate and include more doctors and nurses and those professionals, and share with them about deaf caregivers and their needs? All right, Sandra first, and then I'll turn it over to Frank. Go ahead, Sandra.
Yeah, related to interpreting services, I decided to take my mother to go to the emergency room. I had to because my mother didn't have a doctor here in the United States yet. Her doctor was in Germany and had been there for so long. And after 15 years, there was no medical history. So the doctor recommended taking her to the ER and to go in to be seen by a doctor. So my mother's hearing didn't need an interpreter. And I thought, no, I need an interpreter for me. And they said, no, your mother's hearing and we don't need to provide an interpreter, but she's got dementia. And after some back and forth, I got an interpreter, but the policy for providing an interpreter is for deaf people, or, is for deaf people. And so there needs to be some sort of workshop out there about providing interpreters for everyone, not only, just hearing patients, but with their deaf family members as well.
And then Frank wanted to add, yes, thinking along the same terms, a CDI, a certified deaf interpreter, would be so helpful. We were so impressed to have that access here in Rochester. That was not available in Philadelphia. But here, we demand a CDI. We know we have to have one because as you were talking about, you need, Sandra, you need an interpreter for you. In the same way, I need an interpreter. I don't want to be the one trying to make sure that my mother is clear for the hearing interpreter who has no idea what she's trying to say. And so I felt like I was filling that role of an interpreter while dealing with all the emotions. And with my mother not believing me and not being able to communicate, me having to say, hey, this is what the doctor said, it was too much. And so having a CDI was the absolute best thing we could do. And that's something I'd like to add.
Yeah, I think often it can be a no-win situation. We're educating the doctors and the nurses and the social workers to understand, but where's the deaf people training them?
They need training, they need workshops, something.
Yeah, Jose.
Yeah, I had two thoughts. The first, I had my family member in my home for 6 months, and it was difficult. She wanted to pretend everything was all right, but I was taking care of her full time. And when a nurse would come, sometimes I'd get an interpreter, but the interpreter was struggling, right, and I couldn't tell if they were clear, and I was missing things, and I didn't have full access. I need an interpreter who can be just a professional and just there and not filling multiple roles. And this is when there was an emergency situation, it was really difficult. There was a lack of connection and knowledge, and I didn't know what was going on because I didn't have an interpreter. So that access is so important. And I know that there's the cost associated, but I ended up in a very difficult situation because of that multiple times.
I think that we could keep going, but I think that this just scratches the surface. This is just the beginning of a much larger discussion. And, I'm really committed to this work. And I'm sure you all are as well. I would like you all to please stay on screen, and we're going to open our Q&A session. So I'm just looking through the Q&A to ask some questions. Some of them might be directed to specific folks. Other ones might just be more general.
Okay.
There's one general question about how you decide for a person with dementia when they should stop driving. And how did you approach that? How did you decide, and what was the determining factor? Eileen, you're nodding your head.
Yes. We were somewhat lucky that his mother doesn't drive.
Oh, she doesn't drive.
No, she was involved in an accident. And so after that, because of the trauma of it, she didn't want to drive. However, in my support group, that is a huge issue. Driving is a huge issue because losing driving means loss of independence.
Yes.
And so that was very difficult. And I saw people struggling with that. And so it's the same for deaf people with dementia. They want to be able to drive. And if they can't, that's difficult. So we were lucky in our case that wasn't what was happening. But it sounds like Sandra has a different experience.
Yeah, Sandra. So my mother did drive quite a bit and often would get lost and would lose her way. And the police would find her and
The police made the report.
Yeah, the police reported to the DMV about the situation, and DMV revoked her license. And it was her dementia, and she thought, okay, and things went on.
Jose saying, I don't have any specific connection with that question. I was grateful that my mother had never driven. So that was helpful. But a good friend of mine, his mother has dementia. And she was going the wrong way on the highway at one point.
Oh,
Yeah, and it was really scary. And so that was heartbreaking, that situation. So I would definitely ask a doctor to make that decision rather than having to make that decision on my own.
yeah, that's a good point. I'd like to move on to the next question. They've asked, so while you're sleeping, if something were to happen in the middle of the night while you're sleeping to your mother, how would you manage that?
Sandra's saying, I had my mother sleep with me. It was the only way that felt safe. Yeah, I felt like back when I was a child, it was a reverse situation, right? My mother's health was going down and her ability was like a little child again. And so I had her sleep with me like I was her mother, even though in reality she's my mother, but our roles had been reversed.
Frank, Eileen?
Yeah. Right now, things are okay. She can be alone sometimes, but I do keep an eye on her. And so just knowing she's in the other room.
Yeah, but while you're sleeping, how do you watch her and make sure she's okay?
We're okay with having her in the other room, but we do have flashing lights that are set up throughout the house. And so overnight, the lights will turn on if she's moving around. We have a lot of those lights, so that helps us. And that also helps my mother so she can see where she's going as she walks to the bathroom.
Yeah, and the bathroom is close to her room, right around the corner.
So those lights turn on, and then I can usually spot it if the lights go on because of that and keep an eye on her.
Yeah, I mean, there's the shadow as well that we can see.
So when she walks by, the light goes on?
Oh, no. They're illuminated all the time. But we can see the shadow when it walks by. I'm a light sleeper. And so if the room, I can tell if the room gets a little bit darker just by the shadow going across the door. So if she does get up in the middle of the night to go to the restroom, I can get up to check on her. And so we get up and check.
It's like when you're watching a new child, right? You hop in and check on them and adjust the blanket, tuck them in.
Yes. And so it's not only battery powered, but they're plugged into the wall so they don't lose their power.
Great. Next question.
I think Jose wanted to comment.
Oh, I'm okay. We're already moving on to the next question. It looks like there's 31 questions.
Yeah, a lot. I missed that.
Sorry, I was reading through all of those questions. One someone wanted to ask was, after this film has been created, what's next? People are very excited. They've been motivated by what they've seen. What are they going to do with that energy? If people want more, what's the next steps? For example, we do have some independent, mostly kind of like independent living situations for deaf people in the US. There's only a handful here and there. So with people who have dementia, could they be put in such a place? Do you have any ideas or suggestions based on your experience? Sandra.
I'll let Frank go first.
No, go ahead, Sandra.
Okay. So while I'm living here and working during the day, I did find a daycare in my early research for senior citizens or for persons with dementia. And I thought that would be a great fit for my mother. She's hearing, they provide services. But I do think often about deaf folks with dementia. It would be nice to have some sort of program similar for deaf adults with dementia. And so that might be something to consider or to provide.
And
Frank.
then, yeah, Frank is saying, I'm thinking about that and about what's next. And I think, first of all, so much respect for the people who are doing the work of caretaking right now. And what I'm thinking about, I'm ready. When I think about other people who have this sort of situation, I'm really interested, and my heart goes out to people. And I want to know what we can do, right? I'm really motivated to think about what the next step is. And so I'm thinking about how we could take those next steps. And I'm thinking about my mother and what she's saying. And I really would like to be able to teach people from this experience and be able to help other people. And so that's really my dream right now. And we'll have to see what that looks like.
So Frank, you brought up a good point about the MJ grant. There's a hearing, CODA, about people. So MJ grant is a CODA. Parents are deaf, mother has dementia, and MJ posts different things on Facebook, and also YouTube links. And the YouTube links really went viral, and it's so many opportunities to get information. So MJ was able to really garner national attention and international attention as well, just from YouTube alone. And I really believe strongly that Frank, just do it. Your way, share what authentically, and so people can really see that there are real people, deaf people like them, who have these experiences. Their mother's deaf and they think, oh, they might just think that they're the only ones, but there are so many other deaf people out there with similar experiences. I really think that you brought up a good point, Frank. And I think that it's really wonderful, and that we should move on with that. I think we are almost out of time. We can get two more questions in.
That would be fine.
Eileen, I see your hands up, so I want to go ahead and give you the floor.
Yeah, I was looking over the questions and a lot of them were about medications. And thinking about that, dementia and that diagnosis, people think of as a death sentence. And it really depends on the underlying health issues that person has. But once your brain is involved, it's true. There's really nothing that they can do. There's no cure for dementia at this time. There's no medication that will solve this problem. Medication, if taken early enough, it might be able to reverse some of these symptoms for a short time.
And delay.
Right. But really the medication is just to calm down some of that anxiety or to help the person sleep better as a mood stabilizer. Really, that's all medication can do. That's what medications we are doing right now for Frank's mom, just to help her be calm, help her sleep better, and to stabilize her. So unfortunately, that's all we have with medication.
Sandra, would you like to add? Yes, related to medication and dementia, under the Alzheimer's umbrella.
Right. And there's many under the umbrella.
Oh yeah, there's a lot of different things. My mother has Vancer dementia. Sorry, the interpreter. So for my mother's particular dementia diagnosis, there's not medications that she can take. And so there are medications that she takes, similar to what you said, Frank, to help calm her down. But again, there is no cure. There's no medication that will cure the kind of progressive memory loss my mother's in 4th stage, and so it goes up to 12. But my mother is down to level 4. So about 5 or 10 years old. And her brain she eventually will become bedridden, and her brain will function as a baby. And so she might still be able to walk, but things like going to the restroom and things like that, she won't be able to do on her own. And so people need to be educated that there are many different types of dementia, not, what people just might think of right away.
And this is Jose. I wanted to share one thing before I have to go. I think it's really important for people to understand these couple things. One, something I've learned is that in the news, in the newspaper, and what they say is those messages aren't good for people with dementia. You have to remind people that, hey, like you don't want to remind them like that they're going to die soon, right? So we want to avoid the news of shootings, deaths, blood, that sort of thing that will terrify these people. And so I have tried to reduce access to that when I was taking care of my mother, and I just want them to focus on what's going on with them instead of having to grieve all these other things going on in the world. So I asked people to withhold that information. The other thing people have to understand is that, right, when you're born and you're a little baby, and then you develop and you go through this life cycle of learning and growing. And then probably when you're about halfway through your life and you're 30, 35, you're comfortable. Perhaps you have a home, a marriage, a job, a good life. And then in a sense, your mind starts going backwards. And so by the time you're in your 70, your mind might be closer to 18 or 13 in its functioning. And so for my mother, she was about 6 years old mentally. She would cry for no reason, and we didn't quite understand what was happening. Perhaps it was about the food. It was something so simple. It was because her mind was kind of on a backward swing, going back to that childlike state, and all we could do was love her. And so we just did our best with her. Instead of being harsh, we just wanted to be gentle. So that's what I wanted to share.
Oh, thank you, Jose, for sharing your thoughts and expressing that really beautiful story and everything so clearly. I think that it's really wonderful for us to be able to see that.
Thank you.
Something about the questions.
Yeah, I would say hospice is a separate thing.
Mm-hmm.
That's for when someone is very near the end of their life and close to death, they are put in that sort of care. My mother's not currently close to death. She is healthy, but her dementia has progressed. So when she is near the end of life, she will be placed in hospice care. That's normally what happens for everyone, not just dementia patients, if that helps clarify those terms.
Yeah, I also would like to point out that dementia is a broad term. It's like, if you think of ice cream, it's very broad. And how many different flavors of ice cream are out there? There's so many. It might be pistachio or chocolate or strawberry. There's so many different flavors of ice cream. And so things like Alzheimer's, people think they have memory loss, or, that's Alzheimer's. Well, no, there's so many different types. There's progressive. It could progress very slowly, deteriorate very quickly, very slowly. Sometimes people might live for 17 years after their diagnosis. They might have some sort of
NPH, water on the brain.
And so they might not be able to function like they normally would, or they may not. So there's many different things. There's no specific timeline. There's no start of the stopwatch.
Right.
Upon a diagnosis. So I think I would like to ask you all to stay.
Actually, if you could all turn your cameras off.
Thank you for clarifying, Dr. Kushal Nagar. So if everybody could go off camera now.
All right. I hope you enjoyed this film. It was very heartfelt and very touching. I know a lot of people were very motivated to do something, to get out there and provide education, to get involved in support groups, as well as many other things. The Center for Deaf Health Equity has received a new grant as of this morning. I got the news, of $4.5 million focused on cancer screenings. So perhaps we need to write another grant to try to create and support these kind of support groups and that sort of work. If you're interested in that, please contact us. And then there were a lot of other questions and a lot of people shared information with support and resources. So now I'll turn it over to Stacy to wrap it up.
I just would like to congratulate you, Dr. Kushal Nagar, on receiving that other grant. That's really tremendous. And that means that there's more hope for all of you. So thank you, Dr. Kushal Nagar, for all of your hard work and dedication to the center.
Thank you for your support, all of your support, really.
Yeah, and just looking at these comments, I mean, really, it's a sad situation for many people and they're grieving, but we're grieving together. And it is heartbreaking. And I hope that people are able to find the beauty of this situation and the support group and the support network that could be there. And for your leadership, Dr. Kushal Nagar, thank you so much.
And so thank you so much for working with us and for making this come to life through this film. So thank you to our panelists. Thank you, Stacy, and thank you, everyone. Good night.